Good afternoon. Welcome, everybody. Thanks for being here. We are broadcasting live from California and Florida. So nice of you to be with us today, and thank you for joining in. If somebody wouldn't mind just saying hello back and make sure we are broadcasting. This is Zoom is pretty bulletproof, but we just want to make sure we're getting out into the ether. Thank you all for joining. I've I had the privilege of knowing Heather for some time, and we have some very common friends that we both adore. And so I'm glad to not only have Heather today, but in a time that her business and her company and her colleagues, it couldn't be more timely. Thank you, Michael. So just a little housekeeping. We're recording this, and so we can't hear or see you, but we can encourage you, please, and welcome questions in the chat box in the Q&A. And so welcome all the questions, and we'll get to as many as we can. We will be posting this on the YouTube channel for Family Office Insights as a recording. And so if you miss anything or you have others you think that might benefit from listening in today, it'll be posted there in a day or two. So please, again, feel free to ask any questions as we go along here, and we'll get to as many as we can. You're in for a treat. Not only is this super timely technology and company with the risk of having Heather look as tan as I am with a blush. She's super smart and really on top of her game, and she's built an amazing company, and I'm sure you're all going to enjoy her presentation. Heather, welcome.
Thanks, Arthur. Just want to make sure you can hear me well.
Ken, you're perfect.
Super. Well, I'm excited to present today. Not quite sure who I'm presenting to. So we've got some really interesting facts in this deck. It can also be made available to anybody who would like to see it. If you keep in mind that most of the things here have been proven 2 to 3 times or more by others, you can rely on the fact that what I'm telling you is the truth. We have a very exciting, proven, needle-free jet injection technology that is focused on vaccines and therapeutics. It's a really fast, safe, easy method of administration. And in part, we focus on vaccines because in many cases, we make them work better. So with that in mind, let me frame our market for you. We are focused on immunization. And prior to COVID, the annual immunization market exceeded about 2.5 billion shots per year, growing in perpetuity by the birth cohort of 140 million kids and the vaccines that they receive. And we all now know that immunization is important, just like clean water. It's linked to health and prosperity of the world. Our unique devices are optimized for vaccine administration, and we address the hazards that are posed by needle stick and reuse more efficiently and more effectively, creating a savings for every single injection back for the user. And even more exciting, it's a growing market because there are more than 100 novel developments, excluding COVID candidates now, under development. And Pharmajet today has more than 60 collaboration partners across more than 100 of these developments using our technology. Most people ask me how it works. So it's a fast fluid injection, and I'm going to play a video for you. I'll turn up the sound and hope that you can hear, but it'll show you some patient and caregiver experiences. It is a bit dated in the sense that we've made a number of additional strides since that time, and then we'll jump back into the business after we see how it works. Pharmajet's an easy push-and-click needle-free injection. With global regulatory and clinical claims for IM, sub-Q, and ID delivery, we eliminate needle stick, trash, and reuse. In field and sophisticated care venues, patients greatly prefer the experience, and training takes 20 minutes.
Using a needle to administer vaccines in a busy pharmacy can be a challenge. I've been stuck by a needle, and not only does it hurt, but then there's the process of follow-up and having to get tested and worrying about any health concerns. I load the syringe, I tell the patient they're going to hear a little click, and then it's over.
Pharmajet's delivery can enhance the immune response several-fold. For the polio eradication initiative, intradermal delivery can cut the dose by 60% while producing a superior immune response. We've also engineered out the waste, capturing more doses per vial, creating a positive ROI for each injection. Global acceptance of Pharmajet's needle-free technology as a standard of care for the $3 billion annual immunization market is our mission. With 28 collaborations across more than 40 injectables, we are looking for partners to help us make that a reality.
So you can tell it's a little dated because my hair is longer, but that's probably because I've been at home and not going to visit my hairdresser lately. Anyway, Pharmajet's a safe, fast, easy, tested, and approved technology. We have regulatory clearances from things like the FDA, World Health Organization, CE mark, and that's allowed us to register in 42 other countries with 50 more underway. We have unique clearance for all 3 tissue depths, that's intramuscular, subcutaneous, and intradermal tissues. A number of patents, which I'll come back to in the presentation, help provide additional protection. And essentially, we're able to address needle risks. We've created a needle-free technology that is very, very efficient. We tend to capture more from the vials, typically about 20%. And it's a push and click, simple injection. In fact, many of these pictures are from experiences that we've had in various places in the world. And most recently, I was sharing with Arthur that 500,000 children have been immunized in 5 days using Pharmajet's device, with 99% patient and caregiver approval and an extra 20% participation. So again, we've proven that it works and it's safe and fast and easy. With respect to our collaboration partners, we are a medtech biotech facilitation tool. We've worked all over the world, and this is not an exhaustive list, but we have more than 60 collaboration partners. They are using our technology to develop, in many cases, novel vaccines. We've completed more than 60 clinical studies with 70 more underway. So for both existing vaccines as well as novel developments, we work with large pharma, small pharma, well-endowed academics, and government and NGO partners. One of the really unique things about our technology is that we have been able to confirm that by moving from injecting into the muscle to injecting into the skin, where the antigen cells are rich, and the cells that essentially help elicit an immune response, the rule of thumb is that 80% less elicits the same immune response. So in other words, a 0.5 ml dose of a vaccine into the muscle versus 0.1 ml into the skin produces the same immune response. In fact, we also enjoy global clinical claims from the World Health Organization for the polio eradication initiative, where 60% less is actually superior. To deliver needle injections into the skin is really hard and painful, and most caregivers can't do it. And ours is a simple push and click, and it's delivered in less than 1/10 of a second, where we essentially create a tool that facilitates this caregiving while at the same time cutting costs and improving the experience for the patient. The bar chart on the left is from a third-party study. It relates to the polio eradication initiative, where essentially we price at a premium, we compete against 5-cent needles, and we still save 30% for every single immunization on a look-through basis, while at the same time using 60% less vaccine, creating a superior immune response, and capturing an additional 20% from the vials, because needle cannulas have waste, and we've engineered out that waste. And it essentially produces an ROI for every single injection. On the right side, the example for flu would be similar, where in fact, we also save costs in comparison for no sharps disposal, no assumed liability, many times which are amortized by users because needles are dangerous, and a number of caregivers would experience needle stick consistently on an annual basis, which also contributes things like hepatitis and HIV. This slide is a framework of regulatory approval that forms part of the layer cake of why we can do what we do. We're a class 2 medical device. Our label says that we can be used for liquid medicines and vaccines in adults and children under the care of a healthcare professional or for prescription home use. We're the first and only needle-free technology to be approved by the WHO, which it took about 2 years to get through before we actually scaled our technology. And these many firsts and onlys allow us to essentially be the only substitute that's appropriate versus needles for vaccine delivery. To add to the layer cake of our protection, we also have 47 issued patents, 13 pending worldwide, and a number of claims that have just been filed around our variable dose devices that are under development. We have a number of trade secrets. Doing what we do is really hard, although our engineers make it look elegant and simple. And when you add these things together, we believe that we have a 5 to 8 year head start on anyone who would like to try and replace Pharmajet. It's not that needle-free is new, but we are the only commercial stage, regulatory cleared with clinical claims, needle-free jet injection technology that is focused on and optimized for vaccine delivery. The other technologies are either in not commercial use yet and have a number of years to go, and or don't have clinical claims, or are only focused on subcutaneous delivery. And because all vaccines are typically destined for either the muscle or the skin, that makes Pharmajet the only appropriate tool. For those of you that have good eyes, this data would represent a few of the studies where the original bar by the FDA was to confirm safety and efficacy and non-inferiority to needles. Not only have we done that, but we've also proven in things like HPV vaccines and polio vaccines that we can reduce the dose by moving from the muscle to the skin. So essentially, fractional dose delivery produces non-inferior results to full dose delivery. However, there are also a number of novel vaccines that are under development, and this chart helps provide the insight that was our aha moment in the early part of our development stage, where we produce a bigger, better, faster, longer, stronger immune response. And while not all vaccines are the same, this trend is very consistent. The green lines represent Pharmajet, the blue lines represent needles. The arrows on the bottom are naive patient, first injection, second injection, and challenge. So on the left axis, the bar of 100, meaning that's the target for immune response. After one injection, Pharmajet achieves that, the needle group doesn't. After the second injection, Pharmajet's boosted even higher, and the needle group never quite makes it to protective immunity levels. And in the end, the challenge that was made, all of our subjects survived. Coming to our business activities, we have 3 pillars of activities. The Global Polio Eradication Initiative is an initiative to get rid of the oral drops, move to the inactivated vaccine. And we have clinical claims from the World Health Organization showing that 60% less vaccine is superior when administered with Pharmajet versus a full dose into the muscle. Gavi, which subsidizes more than 70 countries in the world for their vaccine administration, has agreed to subsidize Pharmajet's product for any of their member countries. And then there are a whole host of additional intradermal vaccines that either we've proven we can reduce the dose on or are already delivered intradermally. With respect to our pandemic preparedness federal markets activities on the right side, initially we were paired by the FDA to work with BARDA on pandemic influenza. That will continue, but more recently it's been replaced with a focus on COVID. We have 19 collaboration partners spanning 10 countries. We also work extensively with a number of agencies. A contract of $9.5 million for Pharmajet is underway where we're developing variable dose devices that will enable us to also start to address the drug market, which oftentimes is variable in dose, age, and weight specific. Remember, our devices are fixed and dosed and optimized for vaccines.
Heather?
But, yes?
would you mind, because we talked about this earlier, this Gavi thing that you mentioned, it's struck me as really interesting, but also give everybody the sense of that subsidy scale in that they're well financed, right? So I just want to give somebody them the audience the sense of that scale, how important that is.
Yes. So Gavi is right next door to the WHO in Geneva, and UNICEF is as well. And so as this triad of relationships has been developed over time, the WHO sets policy, and Gavi is actually the payment mechanism for making sure that vaccines can get to some of the poorest countries in the world. They have stunningly introduced a number of vaccines into the world with their member countries. And they recently raised money from their wealthy donor countries, and they have $8.7 billion now to address not only consistent supply in the programs and initiatives they already have, but to pay for Pharmajet, as well as a number of COVID initiatives that are anticipated to reach these countries as more vaccines become available. I hope that's helpful, Arthur, in that time.
Thank you.
That. So to finish off this slide, again, we have a number of candidates that are under development. Importantly, they're in infectious disease, oncology, many other indications which are trying to affect the immune response. We tend to make many of the DNA and messenger RNA vaccines work several-fold better than needle-based delivery, and I'll show you some data in a moment. But more specifically around polio, this slide should give you an example of the fact that one country all by itself, Nigeria, could take our entire capacity for immunizing their children for polio. These are all verified facts. 60% less is a superior immune response, 20% more out of the vials, 2 to 3 times faster than needle-based delivery, 99% preferred, and 50% less weight and waste, and that includes used needles. Because the oral drops have a live virus, 155 countries signed up to a World Health Association agreement to eliminate the oral drops and adopt the injectable vaccine. That vaccine is 20 times more expensive. So as a result, Pharmajet not only stretches the supply, but also saves money. And therefore, Gavi is the one that saves the money by offering to pay for our technology for these countries. Nigeria's birth cohort is about 7.5 million children per year. We would produce 12 million in savings for them, or an additional 4.2 million doses to help address their annual immunization needs. Our current engagement with about 14 countries, which has kept us very busy lately, constitutes about 14 times the capacity that we have. Every child will need 2 polio immunizations. Our current capacity is running at a little less than 10 million syringe per annum throughput, and we have another capacity increase underway for an additional 45 million in automation.
So what's that mean in terms, for those of us that always think about money, that's me, if it'll consume your capacity, how much revenue is that represent for Pharmajet?
We're kind of the dollar a shot guys. So our syringes, we sell within this initiative at a discount. And I can't tell all of our secrets online right now.
No. Oh,
our filling adapter can be coupled with multi-dose packaging. Typically, it would be a 10-dose vial or a 50-dose vial. And then our injector, which has been tested to 30,000 uses without failure, is roughly $400. So it's fractional pennies per delivery. Gotcha. So when you look at kind of multiplying the number of kids times $1, that tends to get you to our revenue number. Gotcha. We're razor blade, but many of these purchases will be front-loaded with more injectors because Gavi's objective is to make sure that every single one of the clinics in that country has one of our devices. We've already deployed to places like Cuba, a small country, but they're using it in all of their clinics. We've had experiences in places like Pakistan in mass immunization settings. And now it's about consistent country rollout into each one of their facilities. So this initiative will go on for the next decade or two.
Yeah, perfect. Thank you.
You bet. So moving on to COVID for a minute, I'm just using a couple of examples here to give you an idea of also the volume needs. And again, we can multiply by about $1 a shot to equate to what our revenues would be. We started the year not knowing what to be prepared for, but as of the start of March, we have amassed 19 collaborations with partners across 10 countries. 6 of those are at clinical stage. We have these bookends that are examples. There's a vaccine on the left that's preparing to enter into phase 3. It is a foreign country with a very, very large population, and they have an estimated need of 100 to 200 Pharmajet needle-free intradermal syringes to be able to accommodate the vaccine at the volume that they're planning. We anticipate that there will be data by April from their phase 3 study. With respect to the diagnostic, it's a really interesting biopolymer, and maybe someday, Arthur, they can present to your network. But it's essentially a drug delivery platform that allows for the detection of antibodies in a slow release format. It can last for 6 months. The military would be the first to use it. It would be injected with our intradermal device. And if somebody starts to develop COVID antibodies, it would light up. Besides coronavirus, however, they also have a platform that provides for stem cells to be delivered, slow release insulin replacing stem cells. And so far with the preclinical work they've done, the mice as an animal model, those mice have not needed insulin for 8 months. They would work with us next year to enter into their clinical stage studies and roll out thereafter. And essentially it would replace daily use of insulin with a Pharmajet injection that might be needed once every month, 2 months, or 3 months in time. So lots of savings, lots of utility, and we're the delivery method for their delivery method in a slow release format.
Super cool. I didn't know about that.
Yeah.
Thanks for sharing. Yeah.
In fact, people can go visit our website. Some of our partners are public and some are not. So in certain cases, I can't tell you without an NDA in place any more details. But the biopolymer is a company called Diomics. So moving on to our novel vaccine array here. It's intentionally small enough that you can't read it, and also the partners are hidden. But essentially, among these numerous collaborations, which are around the world, with more than 100 candidates for infectious disease, oncology, autoimmune, antibodies, and others, the starred rows there that you see are partners that have chosen to discontinue needle-based delivery. Basically, they're finding that we make the immune response higher versus needle-based delivery. And or many of them are using both device platforms to range find to determine whether or not 0.5 or 0.1 or a combination of those things is optimal for their injectable. According to the FDA and regulators around the world, we become not only a named method of administration on their labels, but in many cases, we will be the only method of administration on their labels. And the closest to market would be these COVID candidates. We also have an oncology collaboration called Vaccibody, if any of you want to do some more research, that might come to market within the next couple of years. But even if only a handful do, our net present value of the stream of royalties and product purchases to Pharmajet is worth well more than $100 million. We end up entering the licensing arrangements because, particularly if we make their vaccines work better, we feel like we're an essential component, but they also need to rely on us so that we can supply them over a period of time. And as these things come to market, we have very significant gross margins because we have no marketing costs and no distribution costs. We go down their channels, and we do not pay for these studies. So it represents an enormous investment around Pharmajet by these companies. Large pharma, small pharma, well-endowed academic, and NGO and government partners. So to share one of them, which is kind of joyous for us, this is from Dr. Fauci's lab at the NIH. We embarked on developing a Zika vaccine candidate with them. And this data was published in Lancet, where they basically had an approach of determining if one injection or two injections would help boost the immune response. So on the left side of that graph, it's one injection with a needle. In the middle, it's two injections with a needle. And on the right, the red box is Pharmajet. Two Pharmajet injections is six-fold higher in immune response than a single needle injection and threefold higher than two needle injections. So this is a prime example, again, where certain partners reach a stage where they discontinue their needle activities because Pharmajet makes it work better. So coming to our round, we have an equity investment round that's been approved by our board and shareholders. It's a $10 to $20 million round. So far, I've raised $66 million from high net worth and family office investors. It's not that we're against institutions at all, but these people care greatly about what we do, and they form essentially a global network. We have an SPA that's available for people to look at, as we already have certain commitments, both from existing investors and outsiders. The use of funds would be deployed over the next 18 to 24 months. And please keep in mind that most of this mapping does not include benefit of any COVID needs. That would be extracurricular and may constitute an additional scale up that would either be through some vendor financing or maybe some small increment of additional equity, unless it's provided by the partner and or government. But the capacity increase that's underway, which is about a $5 million expenditure, some of which has already been spent, will reduce our cost of goods sold by 50% and allow us to surpass break even, which is an annualized run rate of about 11 million, and be self-sustaining, as well as pay for additional capacity increase out of our cash flow. The working capital component is kind of a 4 to 5 month period of time, where not only is it sourcing materials, but producing the product, packaging, sterilization, and then shipping it to our customers. And then we have an overhead component there that allows us to have some breathing room while we, again, get everything geared up to handle all of that additional new capacity. Go ahead, Arthur.
I was just, are you taking on the manufacturing of the device yourself to reduce the cost, or you're just at scale, you'll be able to reduce the vendor cost to 50% for the device, cost of goods sold?
An excellent question. And I'm going to jump for just a quick moment to a different slide here. We have an existing relationship in Wisconsin with Philips MedSize. They produce our product today. And Univac, which is in Singapore, is our new partner that are in process of our capacity increase. Not only are we doing this for redundancy purposes to be able to supply our partners, but also we did a global search and after working with Philips for a number of years to make sure that things were in good order and understanding how important it is to have certain kinds of quality, our vendor search located Univac, and not only is the pricing better, frankly, but the service and quality will probably be higher. But it also importantly allows us to serve different geographies with our production capabilities. So
Great.
moving back to our round, and I'm going to jump here to a slide that's a little bit about my team. I come from a private equity background. I am a co-founder of Pharmajet. I am officially the vice chairman and kind of chief advocate. But as you can imagine, I spend time talking about our business as well as raising money. But I'm supported by an amazing team of highly qualified medical device professionals. Ron Lowy is my executive chairman. He helped to orchestrate the Thermo Fisher Bioscience roll-up and merger. Chris Capello started with us as an engineer about a decade ago, and the technology that you see that is prime time is essentially things that he has helped us to develop. And Jeff Jordan, our CFO, not only is he an engineer, but he's also had overlap with Ron in Thermo Fisher and several other med tech companies. So we're a serial group that's worked together for the last 7 to 10 years to essentially have accommodated all of the developments that you see outlined in this deck. So coming then to what happens in the future. If I'm lucky enough to have anybody on this call be interested in learning more about the investment opportunity, be happy to share that with you, including returns. But essentially, Pharmajet is always being positioned as a building block for other companies. That's from day one. And we don't want to prematurely see that happen if we don't have the right partner ready to go to help us there. It's not a buy and shelve kind of business or technology, because we want to make sure that these valuable developments are well deployed, including in some of the poorest countries for things like our polio initiative, as well as for novel new developments that will be coming to market in the next few years. But with all of our regulatory approvals, our clinical claims, lots of firsts and onlys, we become important to other non-traditional potential acquirers, including pharmaceutical companies. So COVID represents the best example of a biotech innovative company partnering with larger companies. So BioNTech is a German company, Pfizer is its partner, helping to scale it up and roll it out. We have numerous examples of that occurring within our novel portfolio, and particularly because we have more than 50 nucleic acid vaccine candidates. This opens up a universe of potentially larger pharma wanting to acquire Pharmajet. And we've also had inquiries from some non-traditional, multi-purposeful med tech companies as well. So consequently, an investor in this round would probably see pricing of Pharmajet using multiples of 7 to 20 times revenue. That's based on current peer benchmarks that are relevant for Pharmajet, which easily equate to a 5 to 7x for investors in this round. So we've taken on a tremendous amount of risk for investors. It's not exactly the 15x that early stage investors would like, but we know that the returns are solid. And given the next 24 to 36 months of execution with some additional capital, we're excited about the future. And of course, if it's not a trade sale, then it would be a flotation. But we're always positioning this business for exit. And with that, Arthur, I think I'd like to open it up to questions that anyone may have or you may have. And if you'd be kind enough to read them out, I'm not quite sure I can see them.
I got it.
Within.
Yeah, thank you. That was great. Michael, hi, Michael. He's a good, smart friend, by the way. Early on, you talked about the Gavi. It's actually subsidy, right? And he was wondering what the reimbursements look like in the US compared to the subsidy, for example, that you mentioned with Gavi, or just the discussion around US market and that reimbursement, would it be higher or so forth?
You bet. So I'm going to jump back to this slide that frames a little bit around, the underlying costs of our technology while I address that. So on the right side, this would be a typical example for the flu shot in the United States. On the left side would be the typical polio example. So keep in mind that in polio, we're competing against 5-cent needles, and we save lots of time and money and stretch the dose through our fractional dose approach. Conversely, if we were using a full dose in the United States, because there is amortized liability and a required cost of sharps disposal, and we also get more doses out of the vials, we save money and plow back a positive ROI for every single injection. We tend to price at a similar level to needles. In the United States, that would typically be about 75 cents to $1.50 per injection. And the CPT codes that would cover methods of administration, the gauze, the gloves, whether or not it's needle or needle-free, it's the same. So it is fully reimbursed to the user. Did that address the question?
I think so. Yep. We have another question from Shirag. I'm sure I'm pronouncing it wrong. What are some of your most immediate challenges in growing your scale other than increasing your capacity?
It's a really wonderful question. There's just not enough time or hours in the day. We have a search on for a couple of really key hires. So some of the funding that we're wanting to have in place would certainly go to address that. But we have an extraordinary team, and truly we have a lot going on. Focus is everything. And someone might pose a question about why we're not in every single doctor's office. The truth is that it's not very efficient for us. It's much more efficient for us to work with really large partners in really large verticals so that we can go down their channels. So polio deployment, as an example, in these various countries, we have relationships with distribution partners. They're on the ground, they're local, they can hold our registrations, they can address any of the needs that would be reportable within our quality systems. So I think in part it's capital, but it's definitely people and execution. We have executed very successfully, we know how to do it. So a little bit more time, a little more money, a little more capacity, and we keep doing that again and again and again. I think that's really the key to Pharmajet's future success and growth.
Would one start seeing Pharmajet in the US anytime soon through one of those verticals, for example? Or would it be waiting for someone for an acquisition? And I know that's probably not a fair question, the second half of it anyway.
So the diagnostic here, this is a DoD funded study, and the first use would be with the US military. That would be an example of something that someone would see soon here. The COVID vaccine candidate is outside the United States. However, we have pending BARDA applications for phase 4 studies where we could be included as an alternative method of administration for anything that gets approved. And as many of you may have seen in the news, the FDA actually approved the Pfizer vaccine today, and I think the Moderna vaccine is closely behind it. But there's more than 140 candidates in the world that are being advanced because there's not enough capacity, there's not enough vials, there's not enough needles, and we fully expect to be part of solutions in a larger scale, frankly, outside the United States at the moment. But I do think that coronavirus is going to be a little bit like the annual flu mix. It's here to stay. There are estimates that it will be through 2027 before the world can be immunized. So again, if you give us a little bit of time, we would very much like to be able to play a unique role in the United States. And primarily that will be around stretching the dose potentially, but more importantly, actually inspiring immunization, because about 15% of the human population is highly needle phobic. And we've proven that they show up to take a needle-free shot versus needles. And then again, it's a simple push and click. You can mail this to the parking lot in the middle of nowhere and have somebody self-train and begin immunizing. So highly effective to be able to essentially roll out under really urgent needs. We have a number of pharmacy partners, and the pharmacies will be the first channels in the United States to deploy the COVID vaccines because they're essentially on every street corner.
Yeah.
A little more time and I'll be able to hopefully wave the flag in the United States for Pharmajet COVID immunizations.
Very cool. Would you exhaust the UNIVAC capacity given the opportunity to?
Yes, I mean, we can see the light already. The number of polio countries, again, exceed our current capacity by 14x, roughly 140 million annual need. That will gradually take place over time because typically countries are going to deploy on a smaller basis before they do a full country rollout. Although we do have exceptions, Uganda is preparing a full country rollout for 2021. And then with respect to capacity needs around COVID, we absolutely could kick off another cell, another kind of roughly 50 million syringe cell, or we could do a bespoke development with a number of molds that would increase our injector capacity as well. So rule of thumb might be $25 million equals 100 to 200 million needle-free shots on a throughput basis through the robotics, and mold cavitation for all of that, plus 50,000 injectors. So big plans coming. That's not within this deck, but of course we would be delighted to talk about that with anybody.
This might be something you can't talk about, but I heard earlier talking about your patent and the challenges. Is the patent suit, and I'm just naming it that, one that is fundamentally being used by another? Sounds like there's a little drama there.
No, there's no drama at all. In fact, we have several freedom to operate searches that have been completed by a number of our partners. So there is no blocking IP. However, on the other side, we have a few that we're watching closely that they're in different spaces. They do different things. As an example, there's a product called Portal. It's destined for biologics delivery, very slow, very high volume home delivery that may take several seconds. We don't do that. They don't do what we do. We don't do what they do. In all likelihood, we'll never run into them. But also, they can't compete with us on price and cost. We can be cost competitive, price competitive with needle-based delivery. They can't. And so an injectable that's $30,000 a year for a biologic, as an example, no one's going to question the cost of the device. For us, it's about very high volume use of our technology in a market where we essentially can help many vaccines work better than needle-based delivery, or cut the dose and stretch the supply.
Got it. I'm sorry, I'm reading this question as I opened it up. How would we reach out to you if we'd like to get more information? So I'll answer that. And if you ask that question, for some reason you're showing up as anonymous attendee, so just identify yourself, please. It's probably a Zoom thing. So we will there's Heather's information right there. You can contact her directly. We will be giving Heather the list of registrants and attendees, and so they will be reaching out to you directly, and you can contact them. And of course, we welcome that. And full disclosure, as usual, we don't have any skin in the game here, except we really like what Heather's doing in her company. And we'd love to see massive success for her and all the investors as well. So the full disclosure part of that is I'm not promoting it because I'm going to make money. I'm just going to stay friends. So if there's, we have a bunch of folks that have asked for the information, Heather, so we'll make sure we get it to them. Would you like to just offer a wrap-up statement, and then we'll post the recording up, and if there's any other further questions, please send them in. Heather?
Yeah, besides being able to have the pleasure of kind of spreading the word here about our investment opportunity, the truth is that we also are very open to collaborations. So to the extent that there are injectable medicines that are under development that are aimed at, essentially boosting an immune response, we do that really well. So we would be delighted to collaborate with anyone that others may want to connect. And then with respect to the approach for fundraising, sometimes timing is everything. So there are occasions where we have not had a fit with institutional investors because the timing was wrong. So when the world crashed last time, I think a lot of the investors, the institutional investors, were kind of pretending to do deals, and they weren't doing deals. So in an untraditional way, we decided to pursue family office investors. We always add investors from the outside because not everybody's balance sheet is the same size. And frankly, when we have an investment offering, not everybody's pro rata gets us to our full need unless everyone is able to participate. So we would welcome any interest, institutional, family office, high net worth. And I'm just, again, delighted to be able to share our story with other people. So thanks for the support, Arthur.
You're very welcome. Doing good for the world and making money at the same time. How about that? So the thing that, just to chat a little further about, if there's anybody in your orbit as attendees and friends of Family Office Insights and members that would benefit from knowing about this, please feel free to include them and connect them with Heather, and share the video, and we'll make sure everybody stays in touch. And as always, my habitual close is thank you for sharing the only thing you can't make more of, and that's your time. Thank you, everybody. Till next time. Thank you, Heather.
Thank you, Arthur.